Now, if you're a hay fever sufferer, you've probably spent the last few weeks sneezing and coughing as you desperately try to keep those annoying symptoms at bay. And with a heatwave promised this week, it could spell, so I'll start that again, it could spell trouble for anybody with hay fever as people flock outside to enjoy the weather, regardless of the pollen count. Well, Dr. Paul Carson from the Sleepmore Clinic in Allergy, Ireland, join us to share his advice. Good morning, Paul. Lovely to see you again.
Thank you very much. Good
right.
to see you.
What is hay fever? And why does it make us feel so bloody awful?
Okay, right. It's an exquisite allergy to grass pollen predominantly. It literally gets up the nose, irritates and causes a great deal of swelling within the nose. Pressure of the sinuses irritates the eyes, gritty, itchy, irritable eyes. And an aggressive hay fever spreads down to the lungs and gives people cough, wheeze and asthma. So for years, people talked about it being a trivial, relatively trivial. You know, you've got a touch of hay fever. But as time goes on, we're now realizing it's actually a much more important problem because it can lead on to a whole range of conditions if it's not dealt with properly. Continuous obstruction in the nose, sleep apnea, chronic asthma, and sinus issues.
And by the way, it's not. There are two forms. There's one is seasonal, obviously, but there's also a perennial form of it.
There is. There's a fancy phrase called perennial rhinitis, which means you've got allergy of the nose and sinuses all year round. And usually these people have got dust as well as pollen allergy, a combination of
animals. Dander and that
absolutely,
kind of...
people with cat, dog, horsehair allergy, etc., combined with their dust allergy.
Can you be tested to discern which one you are, to decide which one you are?
I mean, it's relatively simple to get an allergy test, and there are a number of centres that can do that. It's important that you don't go to these bogus ones where you're told you're allergic to the sun, the moon and the stars. There are appropriate allergy testing facilities in a number of centres that can test you and advise what to do.
Okay, all right. Say we've got the diagnosis. I have hay fever. What do you, as a doctor, as my GP, what do you do for me? What do you give me?
One of the things I'm going to immediately mention is we devised a thing called an app, a hay fever relief app. Now, the reason I'm mentioning that is everything's in there. You know, in terms of your questioning about what can we do, well, we created an app which is based on my 30-plus years of dealing with allergy. And you can explore your symptoms, you can tap in your symptoms, and it gives you an instant treatment protocol.
Is this a year-round app?
It is, yes, you can use it.
Because I'll feel differently, my hay fever will be reacting differently at different times of the year, won't it?
You can tap in whether it's the middle of winter or the height of summer, you can tap in your symptoms, and it'll tell you what you can do to help yourself.
Okay.
If it's going on to a certain level, it will advise you to go seek medical attention.
All right.
But it's pitched at the people who rarely go near doctors and who prefer just to go to the pharmacy, buy what they can get across the counter. Well, it's trying to make those people have a better guidance as to what they should ask for, when to take it, how to take it, etc.
Okay, and indeed when to go to the pharmacy, when to go to the doctor, because that can be expensive, right?
Yeah.
Okay, I have it. The app tells me I need to go and see you. What do we do then?
Well, then, depending on what I see, I can prescribe a number of treatments.
My eyes are runny, they're itchy, they're sore, my nose, I'm sneezing, my throat is sore.
We have a solution for everyone.
Okay.
Including special medicines, prescribed medicines, that will unblock the nose, take the itch out of the eyes, and calm you down totally so that you feel much better. Then at the same time, because we're mindful that people do not like taking medicines too much, we can offer you self-help tips, things that you can do to help yourself. So I'm just going to show you one here, if you don't mind.
Yeah.
This is called Allergy Nasal Filter, and this is a product which allows you to literally snip tiny little things into the nose that block pollen grains entering the nose and giving you your allergy attacks in the first place. AIB startup company, an Irish company, and I'm always delighted to plug these because they're Irish.
So they go up on the inside of the nose?
Literally, it's like a little clips that go inside the nose. You barely notice them at all, and they're block 98% of the allergens and pollutants that go in.
Okay.
Incidentally, the mention of pollutants is important because there's a big link between allergy and air pollution creating an aggressive allergy.
Like a perfect storm.
It is, yeah. And in Melbourne last year, I don't know if you read or heard about it, but there were 9 deaths in Melbourne during a particularly freak thunderstorm at the height of their pollen season.
Now, for people, and you mentioned it yourself, people who don't like taking medications, and it would seem to me, just anecdotally, that people are popping antihistamines, way too much, like Smarties.
But with the 100%, that I find the biggest worry about the lot.
Okay, what about natural remedies?
Well, we have a range mentioned in the app so that people can dip in and out whatever they want to take. I mean, there are things like taking honey.
Okay.
There's things like taking natural yogurt. There are things, special yogurts that you can take that are supposed to help the gut handle allergy better.
Okay.
Special eye drops that they can put into the eyes that are non-medicated, etc. There are plenty of products out there, but what we tried to do was make sure that the ones that we sort of endorse, for want of a better word, because we're not getting any money out of them, but those that we support are the ones we think will actually help people if they want to keep away totally from medicine.
When you say take honey, you're talking about taking honey just as...
We talk about, people say we take honey from locally sourced honey.
Okay.
The idea is that because the bees come from, you know, Dublin 18 and they produce the pollen in Dublin 18 and they produce the honey in Dublin 18, that you'll be eventually sort of desensitized against the pollen in Dublin 18. Now, my only concern about that is the amount of honey you would need to take to desensitize yourself. You'd be as fat as a fool at the end of the summer and you wouldn't even know whether you had hay fever or not.
What about things like Neomed? You know, like the washes, the saline washes and stuff like that?
Neomed, great product too. It washes away the pollen. Big thing about Neomed, though, is you need to have your nose unblocked before you can use that product in the nose. If you're any degree of congestion, you do need to have the nose unblocked to work.
Okay, now there are a whole range of things that can be done. So things like the nasal spray, Neomed, all that sort of stuff. The app, where do people get that?
Well, they can download it on the hayfeverrelief.com website, and it's available on Google and Android devices.
And Paul Dowding from the Department of Botany and TCD is actually one of your advisors, and he was our pollen forecaster here in TB3 for years.
We headhunted him immediately because we wanted a really good pollen forecaster. Met Erin do their pollen forecast based on UK's data. We wanted it locally, and we got Paul Dowding.
I know people are looking at home saying, is that Paul Carson who used to write the crime novels? Yeah. It is, but we can't talk about that now because we haven't got time. So you have an open invitation to come back and talk about crime.
Oh,
and crime writing.
Crime. Look, I'm a criminal. Don't quote me.